During this video, I will assess hip mobility, strength and flexibility. At the hip, there are 6 movements. For example, there is flexion, extension, abduction, adduction, external rotation and internal rotation. In order to assess the hip mobility, strength and flexibility, I will assess active, passive and resisted movements. I will begin by assessing active movements. This is done to review the range of motion at the hip as the client moves through the entire range in order to determine if it's healthy and able to go through the entire range. Active movements are defined as movements that an individual can perform independently using their own muscles and don't require any assistance. Passive movements refer to movements of a person's body parts that are executed by an external force, such as another person, rather than by the individual's own muscles actively contracting. In passive movements, the muscles surrounding the joint being moved remain relaxed, and the movement is generated externally. This is used to assess joint mobility, assess range of motion, to have a better understanding of the injury. Passive movements are often performed gently and careful to ensure safety and minimize discomfort of the individual receiving the movement. Resisted movements refer to movements in which the patient actively contracts their muscles against resistance provided by an external force. These movements are used to evaluate muscle strength, power and function. By applying resistance to specific movements, it is possible to assess the strength of an individual muscle group and identify any weaknesses or imbalance that may be present. This is done to improve the way that the injury gets treated. I began with active movement. I started this by assessing hip flexion. In order for the client to do this correctly, I give the instructions to bring your knees to your chest. I then moved on to external rotation. I placed the client into the correct position and told the client to bring your foot to my hand. This made the instructions easier to understand and in order to correctly complete the active movement. I also did the same for internal rotation, which followed external rotation. As you can see in the video, I also held the patient's knee with one hand. I did this in order for the movement to be only the hip. Next, in order for me to do abduction, I give the client instructions to hang one leg off the bed. I did this to ensure that the client was in a strong position in order to get consistent readings each time. This was also the same method I used for adduction. Finally, for extension, I asked the client to change from a supine position and move to a prone position. Then I asked the patient to move their leg to the sky and maintain a straight leg. As the client did this, I put pressure on the lower back of the client to ensure that the patient's hip did not come off the bed. In this next part, I give instruction to the client to be as relaxed as possible. I begin by passively taking the client into a hip flexion, being sure to push the limb in order to reach the end feel of the joint. Next, I took the limb into internal rotation, followed by external rotation. I then passively assessed abduction, followed by adduction. When doing this, I made sure to hang one of the client's legs off the bed. I did this to stop the client moving while going into the full range. Then, finally, I changed the client's body position from supine to prone in order to assess extension. While doing this, I placed one of my hands on the lower back to avoid the hips coming off the bed. Finally, I did resisted movements. I began by doing isotonic hip flexion. Isotonic is the lengthening of a muscle under load, where isometric is a muscle length not changing while being under resistance. After hip flexion, I did hip internal rotation, followed by hip external rotation. These were both isotonic movements. Then I did hip abduction, followed by adduction, and finished off with resisted hip extension. While doing this, I made sure to bring each movement to the start of each range prior to the client pushing against me. I was also sure to look at the patient's face in order to see if there was any discomfort while performing the movement. I also made sure to pay attention to any subjective markers from the patient. The functional test I have used for the hip is performing a squat. I chose this due to there being a lot of hip joint mobility using this exercise. Squatting requires an adequate range of motion, and assessing squat depth and quality of movement provides valuable information about hip range of motion and potential restrictions.